Well, hi everyone, it's Pete here from the Paint Toolkit. And listen, I'm with a good friend of mine actually, Jerry Dunham over there in the United States. And I think I bumped into you, Jerry, a few years ago now. And your work is sort of, well, I found it fascinating to be honest with you, mate. Um, so what we're going to do, Jerry? What I'd like you to do is, if you can sort of in a nutshell, just sort of introduce yourself
Sure.
and all your work around. Um, this thing about the front desk. I know a lot of people are listening to this or watching really won't know what that actually means. But
Yeah.
I know recently you've been doing some work in how you're using AI within this front desk concept. So if you do you want to open up, just introduce yourself, and then we'll go from there with these questions.
So my name is Jerry Durham, and like Pete said, I'm in the US of A. I've been in healthcare, so I am a physio, but I like to say I've been in healthcare for over 35 years now, American healthcare, even though, just as a caveat, I've worked with some clinics in the UK, I've worked with clinics in Australia. There's a clinic, hold up, Canada also. So just for context on this. So here's my journey in a in a very short way of how I got here. I realized in my own practice of physiotherapy in the States that when I went outside of the clinical space, I'm a clinician, and when I looked at the work the front desk was doing in my patient's journey, that led to that person being in front of the provider. When I looked at what my billing team was doing, when I looked at what all my non licensed staff was doing, and I pulled together that work to facilitate the patient's journey within my business, the front desk role, and we'll define this a little bit as we talk, became listen to this, the most important role in a patient's journey within my business. What do I mean by most important? When I trained my front desk on the work that needed to be done to prepare a person who called to schedule to not just schedule, but prepared them to arrive, pay, and stay, their outcomes improved. The business outcomes improved. Everything improved downstream. So, the work I've been doing here forward is all those. By the way, it took me about 15 years to pull all that stuff together. So, I didn't do it overnight and I'm still working on it. Yet, what I learned is when we facilitate all the team members on the healthcare team, right? That everything improves for the patient. And if it improves for the patient, it improves for the business.
Mm.
So when I say I do front desk work, that's what I do. I pull teams together to look at the value of this front desk. And then we work on the strategy of the work that needs to be done to create what I call patient success. And patient success is more than just an outcome, right? It has to be, they feel, right? They feel trust. They feel less fear, doubt, and uncertainty. They know the costs. They know their plan. There's an open line of communication. All these things need to happen to create true patient success.
Mm.
That's the work I do at the front desk, Pete.
Yeah. Can you tell the viewers and listeners how? I know you've been working. I wonder where you were actually at one point, because normally you're pretty active on social media and stuff and
Yeah.
posting stuff. And I wonder where the hell was Jerry, but then all of a sudden you popped up again. You're talking about this AI thing.
Yeah.
How we're using AI. So how again briefly how what's been happening in that area?
Yeah. So we all know, and I'm just going to say this out loud, there's a lot of conversations everywhere about AI in the clinical space, in the room with the patient and the clinician, or AI that the clinician is using to facilitate a better solution for the patient. I'll just leave it at that. Well, right, in my world, I'm like, that's cool. That's a good thing. But yet we're forgetting all those things I just said. So I see all that stuff going on and I'm constantly going, I wonder where AI fits outside of the clinical space, right? And that's where it started, Pete, is that okay, AI looks really powerful. AI looks like there's a lot of value. AI looks like it brings this word efficiency. AI looks like it can help facilitate a patient's journey. All these words. So I started looking into AI probably close to a year ago, Pete, when it first popped up. And where it comes into my world, right? Not documentation, not in the clinical space. I want to see what is AI doing before a patient arrives in the clinic. So I'm looking at things like voice agents, right? People getting on the phone with AI. I'm looking at tools that help move people through maybe doing their paperwork more quickly, right? I'm looking at AI pulling information off of the paperwork and putting it in front of the provider so that patient doesn't get asked the same questions twice. I mean, things as simple as that, Pete, right? Yet we all know it happens everywhere. And it becomes the bane of your existence because you're like, why am I repeating myself? What is this stack of paper? So I started there about a year ago, Pete. I didn't see much value in the process. So I said, it's cool. I'm going to keep an eye on this. I'm going to keep working forward. Then a client of mine came to me. It's just been about 90 days ago, I swear, 3 months ago. Said, Jerry, I want to have you come in and work with my front desk team. Work on that first phone call and work on I call it pre-arrival, work on that pre-arrival process. And they said, what have you been doing in AI? And I said, well, I'm familiar with what's going on, but I'm not doing anything. And then he sent me a website. He said, well, can you check this out? I'm thinking of using it. And I went to the website, and in about 5 minutes, Pete, I saw the progress that all of this stuff has made in maybe 10 months. And I'm going to tell you what my reaction was. Oh shit, I better get in front of this. And literally, Pete, this was like 90 days ago. I'm going to say 100 days ago. As you've seen now, like everything I'm posting is about AI in the front desk. And so that's been that journey. And I'm going to tell you the progress, especially on the voice side, the voice AI agent has just exploded. A lot of the other same things are just people are getting smarter on how to use it. But the voice agent, when I first listened to the voice agent, yeah, it sounded like you were calling the movie phone back in the 80s. It just sounded like a recording of someone, and it was really bad. But the progress it's made now is incredible. So that's where I'll stop there right now. So well, and let's put this huge caveat up there because everybody's thinking the same thing. AI is going to replace all the front desk people. No, it will not. And I've been sharing this a lot, Pete. AI requires human input, and it's just like anything else currently. I'm going to speak for now. I'm not going to talk about the future because it's already moved forward so quickly. AI needs human input and it needs human quality assurance. I'm doing this for my client. I'm constantly listening to the calls. You cannot, and what I listen for on the calls is what is Pete saying on the phone and how does the AI agent respond? And then Pete calls, Pete calls and I hear it, but then Becky calls and she formulates a question. She's asking the same question as Pete, but she asks it in a different way. And then that has to be inputted into the system so the AI knows to respond. So I've been doing a lot of that quality assurance stuff on the back end. So I call it AI enabled front desk team. That means there are people involved. My client, by the way, didn't fire anybody. He never wanted to fire people, but he knew that AI could make the process more efficient. Because, by the way, you could tell the AI, hey, I want to talk to a live person, and they're going to transfer you to a live person. So there still has to be people
Uh,
involved in this
yeah.
process.
I'm glad you said that because when you talk about AI to people, they straight away is how they're going to replace people, etc.
You are correct. And right now, I say, look, it will replace here's my saying, Pete, and I think you'll appreciate this. It will replace you if you don't understand the value of the work you're currently doing. So
Okay.
if you're just a front desk team member sitting there signing notes and looking at papers and not doing anything else, it's probably going to replace you. If you understand your value in the patient's journey within your business and how that helps create patient success, then you will be the one running the AI and managing the AI.
Okay. Let's jump straight on to the questions.
Go for it.
Quite a few questions here, so some quirky ones, especially towards the end. So the first one is how has AI transformed the way the front desk operations manage client interactions with PT companies.
Yeah. So I'm going to talk about the states first, Pete, because this is really specific to the state, but you'll understand this. And anybody listening from outside, I mean, you guys know about American insurance. I'm going to tell you one of the biggest things, one of the biggest steps that AI can take, and I like to say, well, you need to look at where AI can give you your time back. So, Pete, you're working at the front desk. I call and schedule physical therapy in the States with you. You're going to ask me about my insurance and you're going to tell me you'll check my insurance benefit. That process, when you hang the phone up, is a time killer. If you need to call the insurance company, literally, Pete, you're going to be on the phone for 1 hour for every insurance you have to call.
Oh God.
Then you're going to have to document the information. Then you're going to have to put it in the system. Then you're going to have to call me back. So when you look at the right? Let's say you took 30 calls today. That's 30 hours worth of phone follow up plus all the other work. The AI, there are platforms out there currently doing that that has knocked that time down so far, Pete, that all you have to do is make sure you collected the right info, goes into the AI process. The AI process will do all that work, put it either onto some document or back into your EMR, and then all you have to do is call me back with the information. So when you look at the time that gave you, the person working at the front desk, back to now do more important things, that to me right now, Pete, is the number one impact on a front desk team in an American physical therapy practice. There
Okay.
are other examples here, but that to me, Pete, is the biggest. I mean, literally, you're getting hours back from every phone call you have to do that on. And again, that right, and you hear that doesn't eliminate people. Pete still has to take the call. Pete still has to get the proper information inputted, but let the system do that work, right?
Yeah. Yeah. I get that.
So that I think that's the best example in the States right now of
Okay.
the efficiency created and gives you time back.
I want to be a bit controversial myself, really, because I think what happens over there is going to be happening over here.
Yeah, yeah, there
Uh,
you go.
and it may not happen in my lifetime, but you keep, because they're our National Health Service. It's all sort of tinkered with, etc. Personally, I don't want it to go down the insurance route, but it seems that we've got some political movers and shakers who are looking at that to go down that route at some time in the future. But I don't see it. It's not happening. Going to happen next year or the year after. But I think perhaps in the next 5 years or so, 10 years, we'll definitely be going. I think they're really seriously looking at using the private sector. Well, we do use the private sector now because there aren't the necessary staff within the organisation. Excuse me,
Right.
to do that. So I think what you're talking about now is maybe some stuff that's going to be happening here in not too distant.
Let me give you an example. You just made me, thanks for that follow up, Pete. Let me give you an example. Okay, so you're in the UK, you're somewhere in this, right, public
Yeah.
system. Let me give you another place AI is really going to be a game changer, Pete. AI will allow 100% of the phone calls coming into a practice to be answered. Now you go, okay, Jerry, but we have voicemail, we have phone trees. I'm like, no. Here's the kicker. So let's say, Pete, right? Because we hear about longer, and I'm going to tell you my bias in the US, what we hear longer wait times, more calls, takes longer to get to the doctor. You call and let's just say you're calling a physio practice. You call the physio practice, right? You know your call's going to get answered, but here's the kicker, Pete. It's not going to be a voicemail. It's not going to be leave a message. This is where I had a lot of fun with my client. And by fun, meaning I was going, oh, fuck. You know, I was going to cuss, Pete. I said, oh, fuck, this is impactful. Is when the call gets answered, this is again where the human comes in. And this is where I believe my expertise really came in is what information. So Pete's calling a clinic that's booked up, right? And so what? We got the phone answered. I'm like, no, we're going to make this a valuable conversation. What now am I going to gather from Pete so I can move him? It's not just get a voicemail that's going to be picked up in 2 days. What can we gather on this phone call from Pete? By the way, not just his first name, last name, phone number, right? I want to hear from Pete what he needs to us. I need to hear the urgency, right? So I can oh my God, this is getting better. Sorry, I knew we were going to go down these rabbit holes. So Pete calls in. You have a 2 month waiting list, but Pete's urgency is greater than me, Jerry calling in who wants a checkup. So we can set up the AI, Pete, to talk to you, get the appropriate information so the system, the people, the follow up, they know it's prioritized that Pete needs a call first thing at 9 a.m., not the 50 other people that called. Because, right, it's going to prioritize everyone in the manner that you set up the workflow. So I know to call Pete because he needs to get in touch with a provider. Could be an in-clinic visit, could be a phone call. But Jerry is just looking for a follow-up visit. So he's further down the priority list. So AI doing this in a system like yours, and we could talk about multiple other examples, Pete, that it's not taking a voicemail. It already screened you. And now it prioritized it for the person that's going to
And I'll
call.
be, I'm going to be really, really controversial now. What about people with a speech impairment?
Yeah, well, there we go. And you are correct. But here's the deal. Here's the deal. No, that's not controversial, Pete. These are great questions. AI can recognize that and it can then get you to the right place more quickly, Pete. It's not going to make you, right? AI is not going to ask you the same question 5 times in a row because it didn't understand you, right? I went through this on a call the other day, Pete, where someone had an accent and AI couldn't understand the accent. So I went back to my client. I said, we got to figure out a way that once it asks the same question twice, it gets you to a live person more quickly, right?
Yeah.
That can help manage this. So yes, Pete, it can be again, this is the beauty of the human being involved and then what the end result is. Once you type it in once to fix it, bear with me, I'm doing the quotes thing with my finger, it will answer every call in the future in that same manner. So if you don't understand, if AI can't comprehend whether it's a speech impairment, whether it's an accent, and the same thing's going to happen, it moves you up the priority list to go to a live person, Pete.
Okay. But the thing is, what about if the person has lost their can't speak?
Well, now we got, right? Now we got, it's not going to be about an AI voice agent, right? We can hook up the AI. Let's say you go to the website. Hey, by the way, Pete, you and I both know most people don't have this option. How about you go to the physio website and it says, here's a phone number you can call. But what about if the button below is if you, and I'm going to use whatever terms, if you have speaking issues, if, right, any of these other things, click this button. You could then go through the same process, Pete, with like an AI chat or something like that, that will again ask you the same questions, manage you, and prioritize you properly. Right. Because the what I just told you is I just put another friction point in. Now you have to wait for the human. But if we have that button on the website,
Uh,
then you get managed the same way someone who called the voice agent did, right?
okay.
That see, these are the questions that
I
need to
know
be asked
because
early on,
yeah,
right? This is good because we
yeah.
could say,
I've,
right?
uh, I went on a course a couple of years ago. A friend of mine down the gym, she works at I think it's called, I can't remember what it's called, ECL. It's about awareness really about
Yeah.
people visual and hearing
Yep.
impairments.
Hmm.
And I don't know, it just cranked up my. I thought I was pretty smart in dealing with it and all that sort of stuff, but I had a new. It's like a new education really like that about.
Hmm.
And they were showing me the figures on people who are here in the UK with hearing and visual impairments, like
Yep.
how
Yep.
they draw the short story, short
Hmm.
straw when it comes to engagement, like So
Yeah, and I like this idea, right? So if
yeah,
you would like to call in, if you would like to have, Because see, here's the kicker for me, Pete. Both of the results will be the same. So if you click on this, it doesn't mean you have to wait for us to get an interpreter. It
Yeah,
doesn't mean you, by the way, what happens if you don't speak English? If you don't speak English, click this button and you've trained your AI to listen to, right,
yeah,
if I'm in California, Spanish. And
yeah,
by the way, none of those are going to slow the process down. It's
yeah,
still going to
yeah,
prioritize you
yeah.
for a call back tomorrow, right?
Okay.
Or sorry, a contact or interaction tomorrow.
Yeah.
Yeah.
Okay. Okay. Number
Woo.
two.
See,
Question.
this is good stuff. And this is where, back to your original question, this is where it brings efficiency. So remember, everybody, what's best for the patient is best for business. So the processes I look at and the systems I look to create is less friction for the people we want to serve. And by the way, when we do that, it facilitates the front desk having less friction in their day. I always talk about this downstream chaos, right? Front desk is always managing all this chaos. And it's because we're not considering the people, like you just said, those examples, Pete,
Yeah.
that need to be served.
Yeah.
Ooh, that was good.
Okay. Okay. Number two. What specific AI tools or technologies have been implemented to enhance the client experience?
Yeah. So So where it started was on the clinical side. So a lot of what I call AI scribes showed up, right? And these are documentation tools so that when Pete, I love it, right? We just talked this perfect order of these questions. Everybody starts with question number two. And we're going to talk about an AI scribe. So when Pete gets in front of the provider, it's going to make it better. But just think about what Pete and I just problem solved on number one. What happens if Pete has a speech issue or second language, right? And we're not even considering that it's taking Pete longer than everybody else to get in front of that provider. So I am an advocate, even though I started on the clinical side, but I started on the clinical side because that's where most of the work has been done. We've got to bring it upstream and go, how can we give people better access to the provider? Right? Everybody goes, oh, when they get in the provider room. But I'm like, but fuck, if it takes them 2 months to get there, who the fuck cares what's going on in the provider room?
Uh,
For the love of God, people. Right? So context. So it started in the provider room, AI scribes, and there's a lot of good stuff out there. And by the way, I don't even think I know some of the names of these. People said, oh, we're using this tool or we're doing this, and everybody's got funky names for them. I don't know. There's a lot of tools out there for the clinical space. Boom.
Hey,
That said and done.
listen,
Now I'm
listen.
go on, Pete.
I was speaking to Virginia McIntyre yesterday. We did a Q&A,
Yeah.
and I was had to sit back in my chair because she said she lives up here in Nova Scotia, and apparently it takes 5 years for someone to actually to get on some sort of program or see a pain healthcare professional.
Wow.
I know.
So right, so again, who cares? I'm sorry, I'm going to say this out loud. If you got to wait 5 years, why are we spending 1 ounce of time on the clinical side? I mean, that funding, right? I'm not saying you cut it, but there should not be another dollar spent there till you figure out how to get people to
Yeah.
the right provider, right? And what I'm learning with the AI thing, Pete, again, let's talk front end again. By the way, there are multiple solutions out on the front end that I'm learning about. Um, right, different companies that I've been working with. And I don't think it's very hard to find if you just type in AI solutions front desk healthcare, you're gonna get a lot of hits. So I'm gonna say there's a lot out there that people don't even know. I want to go back to what you're saying, Pete, because I think it's important for us to clarify a lot of this stuff. This is why I talk about the front end because I believe, Pete, that the right AI tools applied on the front end for the right reasons will actually improve access to healthcare, not in the clinical space, on the front end, so that the money, the time, the money, and the energy you spend on putting AI and technology into your front end workflows, you can solve more problems that don't need to be solved in the clinical room
Yeah.
so that the money and the investment put into the clinical space will be less.
Okay.
Access. And this is what I went to. If I can get the phone answered 100% of the time, by the way, Pete, you and I both know, if I went to some of the providers in the UK and say I could get your phone answered 100% of the time, they're like, what the fuck? What are we going to do with people when we answer the phone? And then it forces us into that conversation. Well, I've been having some of those conversations. How do we get people access sooner, quicker, with this? And by the way, probably don't have time today, and maybe this will be a good follow up. Maybe we start talking about some of those solutions the next time,
Yeah.
Pete,
Yeah.
because because if I can get that phone answered or the chat bot to prioritize people, then we got to have the next step available
Yeah.
for them. And by the way, I wouldn't create that system for someone. If you came to me and said, get me all my phone answers and everything, and I'm like, you got a 1 month wait list. I'm not going to do this until you help me figure out how we're going to get access to those people.
Yeah.
Why are we going to answer your phone 100% of the time if you got no solution for them?
Yeah. So, yeah, we are going to do another one of these, Jerry.
Yeah.
But I want
Yeah.
a bit
But
few
see,
more.
this is so good.
Get
And
some
these
more,
questions already, Pete,
some more
right? And
juice
you with
involved.
the follow-up questions and everything, this
Uh,
is what people need to be thinking about.
yeah.
And that last thing I said, and this is at right, Pete, you see all my stuff. Do not go incorporating, do not go looking for an AI solution till you understand your workflows.
Yeah.
What happens when someone contacts your business? What happens next? What happens next? What happens next? What happens next? Right? AI will not solve your workflow problems if you do not understand your workflows. And that means moving someone through their journey with your practice, with your business.
Jerry, what I hear when I talk to others that we know, not just here in the UK, but around the world, Canada and New Zealand, Australia, that there aren't enough. You know yourself, where people live with persistent pain.
Yeah.
We're not talking hundreds of thousands. We're talking, well, they're saying 1 in 5 people around the world now. This is not me saying, it's the World Health Organization, I think.
Hmm.
1 in 5 people around the world are now living with long-term pain. So
Hmm.
unless there was a terracotta army of you guys,
Yeah, right. I love it. Yeah.
that
That was a great analogy.
there's going to be a wait. But
Yeah.
so I'm always looking at. I suggest, I said to Virginia last night. Well, are these people that have been on this waiting list for 5 years?
Yeah.
Can
Yeah.
they not attend a course?
Yeah.
Uh, like me, Keith Meldrum, we wrote,
Yep.
we adapted a pain toolkit a few years ago called the Prehab Pain Toolkit. So for those people waiting for a procedure or waiting to get on a program, why can't they be doing something like that? And she was, I think, she was a bit unsure if that's going on already, but they're being signposted to resources. But it's like giving someone well, to me, it's like learning to drive, but here's a manual, but you can't do the practical stuff,
So,
So,
Pete, oh, go on, go on, go on, go on.
so really, there's got to be, because how I'm looking at this is the front desk. Yeah, it's going to be, they have a good experience, but if there isn't the capacity from the physical therapy point of view, then it's, when you say you prioritize, well, how are you going to prioritize 1 in 5 people around the world? You know?
Okay, Pete, what happens? So, so let's say a live person. So let's do this. But what happens? I want to set the stage here. What happens if we took your prehab course, yours and Keith's course, and we loaded it into an AI tool? And Pete, what happens if we took that course, get ready here, and we made up a qualifying conversation that said this person should have the prehab course? So you called you called your NHS office. A person answered. Now we're talking about AI enabled and AI assisted, but I believe you could do this with a voice agent too. But let's just say the live person answered. And you said, "Hi, my name's Pete, right? I have some issues that have been going on for a long, long time and I need some help." The AI could be facilitating the conversation on a screen. So the AI is actually listening in, Pete, and it's gathering your words and starting to, and I know this because I've been trained in it, to what questions to ask you, and I'm looking for answers, and based on your answers, it tells me the next question to ask. What happens if I get to it and it says Pete needs the pain toolkit prehab. And you say, Pete, here's what I'm going to do next, right? You, by the way, we've been on the phone for maybe 8 minutes, Pete, right? This isn't a 2 hour call. Man, let's say 10 minutes. I now know, look, right? And by the way, this is access issues, right? I now get you on the schedule, or I move you forward and get you on the schedule. But I say, Pete, I've got great news for you, right? We have a program in place that we have called the Pain Toolkit Prehab course. And by the way, the whole AI assisted program helped me to get to this decision. So as a front desk person, non-provider, this I know there's going to be everybody's right. By the way, Pete, how many providers do you think going to hate this idea? Because but AI has all the info it needs to say Pete needs this program. And we send you the program. Now, by the way, this is where AI really comes in. Not only does it send you the program, but it tasks out to a care navigator. And I say, by the way, Pete, I'm going to send you this program, and you're going to get a call back from Jerry Durham. By the way, Jerry's title here is a care navigator. Jerry's going to call you back on Tuesday, right? And he's going to, by the way, he'll be able to see if you were doing the program. And I'm going to say, Jerry's going to have access to the program too. He's going to know if you logged in. He's going to know if you've done these things. But Jerry's going to check in because we have found that this program helps many of people, right, during their journey with pain, during their time to see their provider, right? We could bake all this into the program, Pete.
Yeah. Well, the thing
By
is,
the way, and we could do it around the world. All we'd have to do is
yeah, no,
change the language,
well,
right?
we've already developed a patient course, a pain toolkit patient course.
So
Uh,
think
I've
about the
had,
front desk. This is AI
uh,
enabled front desk who's seen this, and the AI is helping me and telling me the next step for Pete. And
yeah.
it's right, it's based on all these things.
But so they could do something while they're waiting to see
Yeah.
a
And I think
uh,
that like that care navigator, I threw that in myself. I think that's important.
I like it.
Yeah,
I
because
would
I
like that.
told
Yeah.
you, I told you, Pete, this is your next step. And you're like, oh, great. They're pushing me off, right? Oh, they're just going
Yeah.
to send me some stuff. But then I said, we have a care navigator. They're going to know if you did this. By the way, this is that patient engagement world I talk about. This is the software I talk about. The AI can enable all this, Pete, can do all this. And the key here is the AI told me based on your answers. I
Yeah.
didn't I didn't have to, I'm not making a medical judgment. I'm not making a medical diagnosis. The AI that was programmed by the experts, the providers, told me what to say next, what to do next. This to me is a huge value, right? Oh, providers, oh, get the patient in front of me. I'm like, you get a 6 month wait list, bro, right? We got 1 in 5 people who need your help. We have to have more solutions for people.
Yeah.
By the way, remember, Pete, this could prioritize people. Maybe
Yeah.
you fell into that middle prioritization. So we move you to the prehab so that now we have the right people in the clinic, the people who need to see the provider.
I got you. Yeah.
But what about someone going through your self-management course that calls up and says, I want to see my provider? And you start sharing all that. You go, great, I can get you set up. Here's what you're going to do in the meantime.
Yeah. I got you.
AI could really facilitate all that. And Pete, to be honest, that's where I want my work to go next. I want to be doing that work you just said. I want to own the first phone call at every health practice in the world to get people to the right place at the right time with the
Yeah.
right person, right?
Yeah. It's how we. The thing is, even since I've been doing this for 20, oh God knows, I feel I don't want to think how many years I've been doing it, but it's always about how do we build capacity,
You got
Oh,
it. That's
yeah,
exactly what we just did.
yeah, yeah,
That's a great, we created capacity. Because right now everybody's going, we have 30 visits a week. Boom, capacity's maxed, right?
Yeah,
We just created capacity, Pete. That's dead on.
I'm gonna skip number three because I think you pretty much answered it. The question was, can you share a success story where AI significantly improved efficiency or client satisfaction at the front desk?
Well, I got another one. The first call that I listened to that came after hours of they called it like 1 a.m., Pete, and they wanted to schedule an appointment. And AI, they were ready. AI took them through the process. They were on the schedule. They knew their cost and they knew their provider's name.
At 1 o'clock in the morning.
1 o'clock in the morning.
I like it.
Right? It's as simple. It can be as simple as that. Now you don't have to wait. Nobody has to call you back. And
Yeah.
by the way, I listened to the call, Pete. That person knew everything they needed to know to show up.
Okay. Number four. What challenges did you face while integrating
Oh,
AI into front desk operations, and how did you overcome them?
right now, Pete, we're limited by our thinking, right? So, oh, someone calls in to schedule. I gave that example. I can't think of a specific example of this right now. I wish I did. I heard some, but you and I could ask two completely different questions wanting the same result. That's been the hardest part of this is trying to come up with every question, right? Because you want to make it perfect on the first pass. And I'm listening to these calls and someone asks a question and I immediately go, oh shit, I totally forgot about that. Now, the AI kind of stumbles over that. They may or may not get you to the right place. But the good news is you only have to hear it once because then you type in when people ask this question, take them in this direction, right? That was the hardest part was really coming up with all the reasons and all the ways someone could ask questions or the solutions they wanted. Oh, yeah. You know what I found out, Pete? Let me give you a perfect example, right? What do you call the first visit with a provider, an evaluation assessment? By the way, what happens when someone says, I want to get scheduled? Do they want to get scheduled for, are they a current patient or, right? So all these things you got to take into consideration. Hi, my name's Jerry. I want to get scheduled. Is he a current patient? Is he a new patient, right? How do we ask those follow-up questions to move these along so Jerry doesn't feel like he's talking to a robot?
See, from my own experience living with pain, and also other people living with pain, speaking to them over the telephone or Zoom or whatever, they can be very angry people because I've never met a, hey, I wake up, hey, I've still got persistent pain. Hey, I'm going to have a really groovy day. You know, and when I'm just thinking, if they first make contact with AI and think,
Yeah.
oh my God, what is it? What's going on here? I want to talk to a human being. Oh,
Yep.
bloody another! Oh, I've got to fill in another form. Are they going to, they start a lot of fear factors, but they're angry and they will just say, "Oh God, I've got to learn to deal with this now." Will they understand me? Will I get the outcome I want? You know?
So, you know what I love, Pete? The first step in my sales process that I train all front desk human members in is acknowledgement. Acknowledge what you hear. And I've done this with the AI voice agent so far. And by the way, Pete, I've heard some people call in and you can tell they're not quite sure or they want to move through it quickly. And I'm going to tell you right now, the AI is getting better and better at acknowledging. And
Okay.
so it's not that Pete's going to say, I want to talk to you now. But if you call in angry, the best thing I can do is say, I hear you, Pete. I understand you're angry. What would you like to do next? I want to
Yeah.
talk to a
Will the
person.
AI pick that up, the anger in someone's voice?
Well, that's interesting. It knows tone, Pete. This is what I'm saying, man. And so if I acknowledge, hey, Pete, um, it sounds like you might be a little upset. It sounds like you might be a little angry. Tell me, what is it you want next? I want to get to a human. I understand, Pete. Let me try. And I've heard it do this. Now, it hasn't done it that, but I've heard people say, because here's the key, Pete. And my client and I both agreed on this. The phone call is picked up like this. Hello, thank you for calling ABC Physiotherapy. My name is Annie. I am an AI voice agent. She tells you right off the front. By the way, she does not sound like a robot. And
Okay.
if she didn't tell you right away, the last thing you want, how angry would you be 2 to 3 questions in and going, what the hell is going on? We
Yeah.
both agreed on this. And by the way, the research says if people know it's an AI agent up front, they're more likely to talk to it, Pete.
Yeah.
Yet again, I've heard people go, give me to a real person, transfer me to an agent, whatever. And she says, oh, absolutely, I can do that for you.
Yeah.
Right. So that acknowledgement, Pete, in that process has to be built into the system. And I've done that.
Number five. So looking forward, how do you see the role of AI evolving in the client experience landscape
Yeah.
for the next few years?
I think it's going to take it over, Pete, between you and me. I hope nobody listens to this. Um, I think it's going to take it over, Pete, because I'll tell you why. It can answer 100% of your calls 24/7. And remember, I'm talking pre arrival. You said patient experience. I think it's going to force, check this out, Pete. It's going to force people to look harder at access. It's going to force people to look harder at capacity. So I think the ability of me going to the clinics and going, I can get 100% of your calls answered is going to freak them out in a good way. They're going to understand that it can't be get everybody on. Currently in America, it's just get everybody on the schedule. It's like, no, meaning they got to come in, right? I believe when because the fact that AI can answer 100% of your calls 24/7, 365 with a process that can be delivered with 100% consistency and managed, like I said, it can acknowledge, it can get you set up that 1 a.m. eval that knows their provider's name, knows that they called the right place, they know their costs, Pete. That is going to be the game changer. And it's going to force people downstream to go, right? What we were talking about. Maybe that because that first phone call needs to become a screening tool, Pete, to send you to the prehab, to prioritize people and not put everybody on the schedule. I believe it's going to force better work from the provider side and access side. That's what I believe. Does that make sense?
Yeah, perfect.
Yeah,
I
I,
like,
I really
I
do.
like
I really do.
you're ticking a lot of my boxes. Listen, we've got a couple of quirky ones here. The last two. If your front desk AI could wear a costume for a festive occasion, what costume would it represent in its role in a
I
client
love
experience?
I think that's good. You know, Pete, the costume is dependent on the people you're serving, right? So, by the way, some of them may show up in what we call fancy dress, right? They're in coat and tie, they're in a fancy dress. But some of the other ones, by the way, for the more fitness forward, they may be wearing workout gear, Pete,
Yeah,
right? So I love that question. And by the way, you know what? That's a good way to think about who is this client we have to serve and how should these calls be managed?
yeah,
Is how would these people be, right? Be dressed if they were sitting in the office or going to an
yeah,
event? I
yeah.
think that's a great question, Pete.
And the last one is if this is the last of it, this is it. If you had to give your front desk AI a fun nickname, what would it be, and what's the story behind it?
Yeah, you know what I'd call it? It wouldn't be a fun nickname. I'd call him the solution driver. I'd call him the problem solver, right? I'd give him a real name. No bullshit, Jerry. No, problem solver, Pete,
Yeah,
right?
yeah,
Because this, to me, Pete, I love these questions. They're going to help you solve your problem, whether it's 1 a.m. or whether it's, 2 in the afternoon.
yeah. Oh, Jerry, listen, we come to the end of the questions. I think it's I don't know how long we've been going at it now for probably just under an hour. But to me, I think this is what you're doing is the work is vital. I can see it, as you say already. I think it's going to be definitely the part of the future. I know my local doctor surgery, they haven't gone as far as you have, but when you can't really ring up an hour and book an appointment. You've got to fill some stuff in over the phone and whatnot. Uh, and I don't know, as you say, it's creeping in there, AI.
Yeah.
And rather it being something to fear. I think it will be become an asset, as you say, speed things up. Because I think, I don't know about you, Jerry, what I found over the years with pain management, it's very fragmented.
Yeah.
Um,
Yeah.
it's about joining the dots really, because um, we got like your physical therapists, we got OTs, psychologists, uh, pharmacists and whatnot. It's and then now we got
You got
self-management coaches and
exactly.
stuff. It's
And
a
there those people, yeah, and those people
how do
need
we
to be
circle the
involved.
wagons? Like,
Yeah.
how do we circle the wagons?
You got it. And so if that AI enabled front desk can listen to the conversation and
Yeah,
knows, oh, Pete has to go to the OT. Oh, Pete has to go to the PT. Oh, Pete, that's the value of this. This is
yeah,
why I say I believe it's going to force the provider side to think bigger and to think broader, Pete.
yeah,
And right person, right place, right time happens. Right now it's like, oh, just get them scheduled. It's like, no, you're fucking wasting. By the way, you're wasting everybody's time. You're wasting the provider's time. You're wasting the patient's time. Time, money, and energy is just, it's a double whammy. Let's use this AI further upstream with qualified people, front desk people, to tell Pete, this is what you have to do
yeah,
next.
yeah,
That's the magic of this, Pete,
yeah,
and not making people wait. You and I both know that wait is killing people
yeah.
and
It's
is the
uh,
biggest issue
it's
in
it's
health.
adding. I always remember a statistic years ago. It may have improved now, but they said someone with back pain, if they've if they've not been sorted, if they still got back pain after a year, the likelihood of them working again is zero.
Oh yeah, Pete, those numbers are still accurate, and they've even
Hey,
brought it back further. Oh, they are dead on accurate. And so the longer it takes, the increased likelihood of longer issues, more money, more time, more energy,
yeah,
more impact, right? On the whole system, which starts at that person.
yeah,
Yeah. So all of this AI could get people to the right place
yeah.
more quickly.
So next steps, Jerry. I think we need to get some other dudes involved. Like Keith,
Yeah.
Virginia,
Oh yeah.
other people like other self managers,
Yeah.
and so they can not fire questions at you, but get to know this stuff a bit more. I think if it really fits in with the self management concept. Um, Ideally, the we it needs to be where the decision makers are involved in it somehow. I think it's going to be small steps, but I think if we set up another meeting, have a conversation with other people, so when Keith gets back and Dave's well again, and
Yeah.
we'll get all the other dudes involved.
Yep.
Probably some of the people, quite a lot of people that we have who join the monthly pain talk
Yep.
conversation, something like that. Okay.
Yep. Yeah, that sounds great. Pete, let's double back on that. And I just want to pile up on what you said. It's going right. I talked about getting people to the right place, right time. That's going to involve having people like you, like Keith, like everybody else involved in the process. So if providers and administrators are putting this program together, you and I both know that I speak of, right? It's not going to be the same, right? Because, by the way, here's the dirty little secret in healthcare. Not everybody who calls today should be scheduled. And I hope everybody heard that theme. And people are going to need to go to programs like self management programs. They don't all have to go into some pain program, some
Yeah.
pain. Because actually, if Pete, with the way the states are going, if I get you to the right place and it's not in the clinic and that's where you need to be, I get paid more. So we all win. This is, I think, patient success leads to business success. But the
What
key,
talking to other people like myself in the state, live in the States,
yeah,
that the insurance companies don't pay for self management.
yeah, correct. But going forward with these programs and the management, maybe we talk about that next time, Pete. I'm going
Okay.
to tell you, it will, and it will benefit the clinics that put your programs in place. I guarantee it
Okay.
going forward. And you're right. If we were having this discussion 2 years ago, I'd be like, yeah, whatever. But no, going forward, Pete, no.
Yeah. Okay.
Cool.
Right,
I
Jerry, going to
appreciate
stop the
you.
recording now. Thanks everyone
Yeah,
for watching and
I
listening.
appreciate you. Thank
Stay
you.
tuned.
Thank
We'll
you
be
so
back
much.
soon with other people involved, etc. And we're going to look at this a bit. Want to take a much deeper dive into it. So, hope you found this podcast useful, and we'll see you all again soon. Take care. Ciao.
Thank you, Pete.